At $7,000 a month for singles and $14,000 for couples, retirement community Oakmont of Pacific Beach is one of the more upscale senior residences in San Diego.
It's like living on a cruise ship that doesn't go anywhere. And when you're a senior citizen, that's kind of a good place to be.
But not lately, says Richard Pijak. He works as a driver at Oakmont. He says earlier this month, his supervisor asked if he could fill in as a caregiver for two women, a 98-year-old and 102-year-old. They both had COVID-19 and were in quarantine. He says his desire to help, plus the offer of $5 extra an hour on top of his $15.50 hourly wage, prompted him to say yes. He says the only training he received was direction on how to wash his hands and put on his gloves.
I was not afraid to go into that room with no training-ish. I knew I could handle it. I knew I could take care of these people.
He wore an N95 mask, gloves, and a gown when he entered their room.
I helped bathe them and, helped them go to the bathroom and fed them, and certainly helped them while they were in bed, adjusting their bedding and transferring them in and out of, the wheelchair, as they went to the restroom. Or
He says he was told that another caregiver would be with the two elderly women, one of whom is on oxygen, when he wasn't there.
Only to find out that there wasn't somebody there, and they, ended up on the floor. And, if this was your mother, how would you feel if you saw something like that?
The 56-year-old Pijak says after working 4 12-hour shifts caring for the women, he began to worry about his own health. He says he approached his managers at Oakmont with two requests. He wanted to be tested for the virus and be put on a 14-day quarantine without having to use his own sick time accrual. He says management refused both of his requests.
Instead, I was brought straight back into the community and told to go back to my regular shifts and my regular job, delivering food to people, bringing them mail, doing Zoom calls with family members.
Pijak also accused Oakmont of not being transparent about how many staff and residents have been diagnosed with COVID-19. KPBS contacted Oakmont, which sent a statement through its public relations agency, The Press Shop, run by Nathan Ballard, a crisis communications strategist. The statement read in part, quote, "At our Oakmont of Pacific Beach community, we are caring for some COVID-19 positive residents. In the course of their duties, some of our staff do interact with those residents. In all of those interactions, CDC and State Department of Public Health guidelines for appropriate personal protective equipment use are followed," end quote. Ballard added that Oakmont is following CDC guidelines when it comes to testing. He also sent a link to those guidelines. However, he did not answer any questions relating specifically to Pijak's allegations. The California Department of Social Services, which licenses assisted living residential communities, also declined to answer questions related to Pijak's experience at Oakmont. Instead, a DSS spokesman sent several links on its rules governing staffing and caregiving. Dr. Carl Steinberg, a nursing home and hospice medical director in North County, says he's not surprised that Pijak was returned to his regular duties without being tested for COVID-19 because of test kit shortages.
It's permissible, and it's far from ideal, and I think it does pose a significant risk to other residents. Because they are so vulnerable. If they do get it, they're going to be the ones that are likely to have respiratory failure or die from it.
He praised Pijak for accepting the extra task of caregiving duties, but Pijak says there may be fewer people ready to answer that call as the pandemic stretches on.
We've had a lot of caregivers just quit and give up or be afraid for their families and not wanting to bring it home, but still wanting to keep their job. We love these people. This is what we do.
Amita, Sharma, KPBS News.